everybody, this is Sky with Shapes Recovery House. Happy Sunday to everyone. So today we are going to talk about vitamins and meds not to take before and after surgery. Keyword, not. All right, let's do it. Okay, so before we jump in, I want to say this. When you go for your pre-op or to sign consents and all of that jazz, there is a long list of medications to avoid before and after surgery. Now, let's be real. I know you guys don't read that. I know you don't read that. You don't have to fool me. You don't have to fool me. But I want you to go back to that piece of paper and look through those medications, especially if you're on daily medications, especially if you're very holistic, you drink teas, you take herbals. Your herbals and your teas may be on that list. So please take time to skim through it, make sure your stuff is not up there, and then you can go about your day. So go back and get your pre-op appointment paperwork, okay? All right, so it's gonna be a fairly short video and we're just gonna dive right in. So fish oil, flaxseed, vitamin E, and aspirin. Those are the 4 medications that just pops to the top of my head that you should avoid before and after surgery. Our biggest one out of those 4 is aspirin, okay? And you can throw ibuprofen in there, you can throw Motrin in there, and you can throw Aleve in there, all to be avoided before and after surgery. And this is why. Mainly for aspirin, ibuprofen, Motrin, Aleve, those are considered blood thinners, and those could definitely affect bleeding during surgery and after surgery. So we don't want that. That's something we really, truly want to avoid. You don't want to go home and you're bleeding because you took an ibuprofen right before surgery. So please stop any ibuprofen, Aleve, Motrins, all of that. Just stop strictly Tylenol or the prescription that your surgeon prescribed to you. Now, when it comes to vitamin E, flaxseed, fish oils, those medications can affect anesthesia, and they can affect anesthesia in the way of like blood pressure. Your blood pressure could be all over the place, and it will be hard for your anesthesia provider to control it. So that's very helpful to lay off of those medications before going into surgery and having any type of difficulty or complications. It also can affect anesthesia in the sedation level. Your anesthesia provider is pretty good. Medications are very strong, but you definitely don't want your body to go against what anesthesia is trying to do, which is keep you sedated and under, asleep basically. So these medications are very important to avoid. Even after surgery, like anesthesia is still in your system, could be in your system for up to 72 hours. So knock these medications out of your regimen for the next 2 weeks. 2 weeks before, 2 weeks after. That's normally what is in that paperwork. That's normally what surgeons kind of suggest. And I am definitely in line with that. You need to lay off anything 2 weeks before, 2 weeks after. That goes with smoking. We'll do a whole nother separate video on smoking. But vitamin E, flaxseed, fish oil, aspirin, ibuprofen, Motrin, Aleve for 2 weeks before, 2 weeks after, all right? We want to be nice and easy for anesthesia, nice and easy for your surgeon, nice and easy for your nurses. And then your journey, your post-op journey should be nice and easy as well, all right? I hope this helps. Go back to your pre-op paperwork and read it. You guys read it. I know you guys don't read it, but it will be very helpful. I hope this video was very helpful, and I will see you on the next video. Mwah.